Hello everyone, welcome to this video session on sexual offenses part 2. In this video, I would like to mainly discuss about sexual perversions, sexual paraphilias and unnatural sexual offenses. So the first which I want to discuss is indecent assault. What do you mean by indecent assault? It is an offense which is committed on female with the intention to outrage her modesty. That means outrage means gross violation of decency, morality or feelings. Here, a man may try to kiss a woman, okay, press her breast, touch or expose the genitalia or thighs. Fine? Okay. Or men may even encourage children to handle or masturbate their sexual organs. This is also dealt under indecent assault. Remember, stripping naked a female patient for medical examination is also considered as an indecent assault, punishable under section 354 IPC, okay, 5 years of imprisonment. Remember, sexual harassment is an unnecessary or an unwelcome sexual gesture or behavior, okay, with the sexually colored remarks, pornography, okay, or any non-verbal context being sexual in nature. What do you mean by incest? First of all, I would like to say incest is not an offense in India. Incest means sexual intercourse by a man with a woman who is in blood relation. For example, sister, grandsister, okay, aunt, stepsister, between father and daughter, brothers and sister, all those. It occurs whenever there is any mental problems or under the influence of alcohol, fine, or when close relations have to live in intimacy, etc. So, see, in this video, I would like to discuss a lot of terminologies. You must know, you must be familiar with all these terminologies because you will get innumerable number of questions in the form of multiple choice question as well as for your, theory viva during your practical exams. All the unnatural offenses are punishable under section 377 of the IPC. What do you mean by homosexuality? Means persistent emotional and physical attraction to members of the same sex. Here, first I would like to discuss about sodomy. It is actually called as anal intercourse between two males. Not only two males, but also between a male and a female. Okay, it is also called as buggery. Very, very important. Suppose here, the passive agent is an adult. We call it as gerundophilia. If the passive agent is a child, we call it as pederasty. And in pederasty, the child is called as ketamite. Okay, these three terms are very frequently asked to your practical exam vibe. And what do you mean by pedophile? Is an adult who repeatedly engages in sexual activities with children. Okay, fine. And next, I want to remind you something that this type of sodomy is more common among sailors, prisoners in hostels or in military barracks. What do you mean by hijras and senas? They are nothing else but called as eunuchs or male prostitutes. They act as passive agents in sodomy. Fine? Okay. So, how will you examine the passive agent? Examination of passive agent includes general examination, proper history taking. In history taking, the date, time and place of alleged act, use of any lubricant, degree of penetration, ejaculation during the act, any bleeding history, a pain experienced either at the time of incident or subsequently, all has to be properly be asked. And any general injuries has to be inquired. Lower rectum and anal canal has to be examined properly for any abnormality. And anal examination, remember the anal will be usually found dilated, irritable and tended to touch. And the digital rectal examination will be very painful for the patient. Okay, yes. And remember, hematoma will be seen, linear aberrations will be seen. Okay, and tearing of the sphincter ana is also seen, and the lesions are marked in children, okay, compared to that of adult. Anal fissures may also seen, which may extend even to the mucocutaneous junction. Signs of struggle like bruises and abrasions, and pain during walking and defecation, and fecal matter around the anus. So all these are the findings that you will see in anal examination of the passive agent on sodomy. So what is the diagnosis? The only proof of sodomy is the presence of, very, very important point, the presence of semen in the anus. What do you mean by habitual passive agent? That means who repeatedly engage in sodomy. There will be shaving of the anal hair. Number one, slight depression of the buttocks. Funnel shaped anus is very rare. And dilatation and laxity of the anus and anal fissures or scars will be present. So these are the features of habitual passive agent. In habitual passive agent, we will usually do a test called a lateral buttock traction test. A thumb is placed on each side of the anus and a lateral traction is applied. And in persons who are not accustomed to sodomy, what will happen? There will be a reflex constriction of the anal sphincter. But in a habitual sodomite, there will be complete relaxation of the sphincter, which occurs with the dilatation of the opening. Fine? Yes. So here, this picture, you can see the examination. You can see the swab from rectum for sperms. You can see the lax sphincter, smooth mucous membrane, and you can also take a swab from the anal margin for semen. Remember, the presence of semen is the hallmark feature of sodomy. And in case of an active agent, the only evidence found is peculiar smell of what? The peculiar smell of anal glands, which is transferred to the penis, and traces of fecal matter and lubricant on the organ. Fine? Yes. What do you mean by buccal coitus? It is also called as coitus per os or sin of Gomorrah. Sin of Gomorrah. This is a very common term which is asked in your exam. Buccal coitus. The male organism is introduced in the mouth into another male or a female, but usually of an young child. Fine? Yes. Remember, it is punishable under section 377 of IPC. What do you mean by tribadism? It is also called as lesbianism, also called as female homosexuality. It is not considered as an offense in India. Fine? Yes. And remember, the excessive sexual desire in women is called nymphomania, and the excessive sexual desire in man is called satyriasis. Remember, tribadism or lesbianism is not an offense in India. Coming to bestiality, bestiality means having sexual intercourse, okay, with between a human being and an animal. Remember, most commonly by vaginal intercourse, and again it is punishable. Okay, it is punishable. Then coming into sexual perversions. What do you mean by sexual perversions? That means these are something what called unnecessary sexual acts or fantasies, okay, mainly for satisfaction, okay, complete satisfaction for sexual gratification, okay, that is called sexual perversions. Number one is called uranism. What do you mean by uranism? Sexual gratification is obtained by fingering, licking and sucking the genitalia of opposite sex. And remember, we have a broad terminology called as sexual paraphilias. Abnormal and unorthodox sex play by using objects or parts of the bodies are known as paraphilias. In that, and one important terminology is called sadism. Here, sexual gratification is obtained by inflicting pain on the other partner. And the opposite of sadism is called masochism. Okay, here the sexual gratification is obtained by suffering the pain. Okay, that is sadism. This is masochism. So sadism means pain is produced on other person. In masochism, the pain is being suffered. Okay, the patient will get sexual gratification is obtained by or increased by the suffering of the patient himself will suffer the pain. Okay, and he will get sexual gratification. In extreme cases of sadism, even murder occurs, that is actually called as lust murder. And remember, necrophilia means desire for sexual intercourse with the dead bodies, which is punishable under section 297 IPC with imprisonment up to 1 year and fine. What do you mean by necrophagia? Necrophagia means the persons after mutilating the body drinks the blood, eat the flesh of the victim to drive sexual pleasure. Masochism, I have already told you. Remember, there is a term called as algolagnia, which includes both sadism and masochism. What do you mean by fetishism? See, fetishism means use of objects, okay, like toys for sexual gratification, and something called as transvestism, also called as eonism. That means the males will obtain sexual pleasure by wearing the female dress. That is called transvestism, also called as eonism. Next is called as transsexualist. They're the persons who have an obsessional desire to become members of opposite sex, and they will do something called as sex replacement surgery. What do you mean by sexual oralism? The sexual pleasure is obtained from the application of mouth to the sexual organ. Here we have something called as anilingus, that is kissing, licking and sucking of the anus by a sexual partner, and cunnilingus, that is kissing, licking and sucking of the female genital by her partner. Okay, yes. And what do you mean by masturbation? Deliberate self-stimulation which affects the sexual arousal, and it is an offense only when it is practiced openly. Okay. And what do you mean by exhibitionism? That means over a period of 6 months. That period is very, very important. Exhibitionism over a period of 6 months or more, or to say on who experiences recurrent intense sexually arousing fantasies. Okay, including the exposure of one's genitals to an unsuspecting stranger. Voyeurism, also called as peeping tom, that means involving the act of observing an unsuspecting person who is naked in the process of disrobing or engaging in sexual, watching other people who are engaging in sexual activity. That is called voyeurism. Scoptophilia, also called as peeping tom. Next is something called as troilism, sexual practice involving 3 persons, 2 of one sex and 1 of the opposite sex. It is actually an extreme degree of voyeurism. And what do you mean by Oedipus complex? That is, we have something called as Electra complex, that is the sexual desire of a daughter towards her father, and Pharaoh complex, sexual desire of brother towards his sister, and Oedipus complex is a sexual desire of son towards his mother. Remember, Oedipus, Electra and Pharaoh. What do you mean by Frocherism? Here the sexual gratification is obtained when the patient is in contact with another person. So that is rubbing his private parts against the female's buttocks, thighs, breast or genital area. It is punishable under section 290 of IPC with a fine up to 200 rupees. Undinism, sexual pleasure is often obtained by witnessing the act of urination by someone of the same or opposite sex. Pyromania means setting in fires, most commonly seen in alcoholism. And caprolalia, sexual excitement is obtained by using obscene languages. Telephone scotology, obscene telephone calls are made. Okay, yes. So these are the important terms. Narcissism. Narcissism means very, very important. Actually, it is a type of personality disorder. Narcissism is actually a type of cluster B type of personality disorder. We have cluster A, cluster B, and cluster C type of personality disorder. We will learn in psychiatry. In cluster B type of personality disorder, we have something called as narcissistic type of personality disorder, in which there will be the patient will love only himself. Okay, he will see everyone else as his enemies. So coming to seminal fluid, you know, in a case of rape, in case of a sodomy, in case of an unnatural sexual offences, semen plays an important role. Semen analysis is important. Detection of semen using various tests is also very, very important. So semen analysis can be first done by physical examination followed by chemical examination. Physical examination, you know, seminal stains will look dry or greyish white in color. Okay, fine, and it will be looks like a starch. Coming into chemical examination, number one, fluorescence test. On putting a drop of fluorescence solution, we can see dark brown crystals, rhombic needle-shaped crystals of hemine. That is actually called as fluorescence test. In barbareous test, we will be using picric acid. Remember, picric acid is yellow. So, yellow needle-shaped rhombic crystals of sperm and picrate is formed in case of barbareous test. This is a very frequently asked question in your MCQ. That is, remember, dark hemine resembling rhombic needle-shaped crystal, dark brown. It is fluorescence test. If it is yellow needle-shaped, it is called as barbareous test. Remember, seminal fluid has very high amount of acid phosphatase. If it is around some 500 to 1000 times, okay, than any other body fluid, and it is usually calculated in the form of Bodansky's unit. Fine. Once that is done, remember, creatine phosphokinase levels of more than 400 are almost diagnostic of seminal stains. Normal seminal fluid contains 385 to 1400 units. And next we have some immunological methods and choline and sperm test, which are completely absolute now. Coming into microscopic examination, spermatozoa will be usually seen. The motility of the sperms will be seen. Remember, the motile sperms are usually seen up to 6 hours, and in vagina up to 12 hours after ejaculation. And complete sperms are seen up to even 26 hours or up to 2 to 3 days. And species identification, we have already discussed in previous videos. It is by the precipitin test. And proof of the semen is at least one broken spermatozoon are very, very important in electrophoresis. If we are able to trace LHD isoenzyme. Okay, LHD isoenzyme. These are the two evidences of sperms. Okay, proof of semen. So, as far as semen is concerned, just remember the physical examination, chemical examination, fluorescence, barbareous, acid phosphatase, creatinine phosphokinase, and immunological method. And microscopic examination, remember about the motility of the sperm, okay, precipitin test, and then proof of the semen. I have already told you, at least one unbroken spermatozoon or electrophoretic LHD isoenzyme. It is not LDH. LDH is lacto dehydrogenase. This is LHD isoenzyme. Fine. So with this, we have finished the two parts of the very big chapter, sexual offences. So hope you would have enjoyed this video. And here the most important questions you have to focus is the various terminologies. And please remember the IPC sections for voyeurism or for then what is the exhibitionism. What is the time period for exhibitionism? It is at least 6 months the patient should experience their compliance. Then the different terminologies, okay, which of them are offense. Incest is not an offense. Tribadism or lesbianism, no, is not an offense. Then sodomy is offense. Okay, sodomy is actually an offense. Then masturbation is an offense only when it is done in private places, public places. And then remember bestiality, necrophagia, all these are offense. Remember the IPC section 297. Remember the IPC for voyeurism, okay, or peeping tom. The alternative names, for example, sodomy is also called as buggery. Lesbianism is also called as tribadism. Okay, remember ketamite, okay, gerundophilia, and pedastry. These are very frequently asked questions. And finally, also remember about the seminal fluid examination. So with this, I am winding up this video. Thank you.